One of the things that attracted me to the program was how close the residents were. We all went out to dinner the night before, and some of the family members, or some of the residents, brought their family members, which I liked, and their families, and everyone seemed to know each other. They all seemed to enjoy each other's company and like each other. They're all pretty close. So that was one of the initial things that kind of drew me here.
I think here at the Department of Surgery we have a really good relationship with the other residents. We all work really well together. We worked together for all 5 years. We're on different teams and with different levels throughout each team.
I think one of the biggest strengths in terms of working with the faculty is that they're really supportive. They are very open and friendly, easy to talk to. Even as a junior resident, they really listen to what you have to say, and they take your input seriously.
So we're a level 2 trauma center, the only one here in Northeast Oklahoma. So we get all the sickest patients, we get all the transfers in from around the area, and then we never go on divert. So even though our hospitals are filled, including our hospital sometimes, we never go on divert. And having that experience as a resident is invaluable as you move on to your individual careers. We are a community-based practice, but with an academic slant, meaning that our guys get about 1,100 cases when they graduate. Full breadth of not just bread and butter general surgery, but thoracic surgery, transplant surgery, pediatric surgery, bariatric surgery, hepatobiliary surgery, surgical oncology. So they get a wide range of experience.
You stay pretty busy, but it's kind of well monitored, and you're always around other residents, and it's a pretty close network of residents. And so there's a good amount of things you're going to do your first year. I think a lot of people really enjoy their first year here.
So as a second year, we do get to rotate at the VA or the Veterans Hospital down in Muskogee. We also get to rotate at Hillcrest when we're doing burns.
Yeah, I think looking back on the past 4 years, I'm really surprised by the changes and growth that I've had as a resident. I think one of the greatest strengths is that I've always had faculty that were supportive of what I wanted to do with my career goals, not just in residency.
Not only do our residents learn more about the whole process of providing health care, they learn a lot about individual health care and how to make the system better wherever they might go afterwards. The other thing that sets us apart is just, again, our academic staff. Currently, we are a faculty of around 9. All of our fellowship trained in either MIS, hepatobiliary surgery, surgical intensive care, or vascular surgery.
Every Wednesdays we have conference. Conference is a protected time. It's about 3 to 4 hours every week, and it's truly protected. You're not supposed to get pages during this time. You're not supposed to get consults, there's during those 3-4 hours, there's a lot of education. We get guest lecturers from all over the country. We go off the SCORE-based curriculum, and there's a journal club about once or twice a month. And that's over the last few years, that Wednesday has really grown to be a lot more educational, and most people really enjoy it.
So while we are very in tune with education and academia, we also do a lot of research to go along with our clinical work. So our faculty is probably the most published in the state of Oklahoma. We have several textbooks amongst our faculty. We're national leaders on 2 boards for surgical societies.
So I think one of the greatest things about Tulsa is that it's not too big, but it's not too small either. It just has the right amount of things that you can do, whether you're an outdoorsy person or whether you're more of an indoors person. There's a lot of things to do downtown. There's the Gathering Place, which everyone talks about, but it's a really nice park. They spent like millions of dollars on it, but it's incredibly nice. I like to go around and walk and hike with my dogs, so sometimes I'll take them to Turkey Mountain, or I'll take them to the Gathering Place, or Woodward Park is actually also a really nice place that's right by the hospital where we work at.
So we're looking for residents basically with 3 criteria. One, they have to have aptitude. So we're looking for the best and the brightest, the ones who have a lot of ambition to be very, very strong surgeons. We're also looking, though, for people with compassion, not just of passion for surgery, but passion for their patients, passion for learning more and getting better, which we think is a trait that's marked by their character. And then finally, integrity. We like people who just believe in what they're doing and are truthful about what their expectations are and what they can do for the patients. So aptitude, character, and integrity are sort of the hallmarks of our residency program. We're looking for all three aspects, not one is more important than the other. We think with that we'll be able to produce the best students.